Hey everyone, welcome to this week's episode of Hormonally Speaking. This week we're talking about a topic that so many of us out there in the world are really focused on, particularly if there's something going wrong with it, and that is our skin, right? Having had acne as a teenager, really until my probably early to mid 20s, I certainly know how frustrating the acne world can be. And then, unfortunately, for some of us that had acne when we were young, we seem to develop rosacea later in life, which is what I did too. So, working with acne, I think obviously traditionally has been this sort of like kill, kill, kill approach from the external perspective, or taking medications that really unfortunately can do some damage, right, to your system. So today we're going to talk about skin health, how that's connected to your hormones, to your gut, and lots of other places, so you can really get to the root cause of your acne and not just try to like kill your skin in the process. My guest today is Emilia Papadopoullos, who developed an interest in skin health from an early age as she developed chronic acne in her teens and was later diagnosed with polycystic ovarian syndrome, otherwise known as PCOS. Unable to clear her skin through medications and skincare, Emilia entered the world of nutrition, which finally helped her understand what her body needed to naturally rebalance her hormones and achieve clear skin. Alongside her nutritional therapy qualifications, Emilia has done additional training with the Institute of Functional Medicine. She now successfully helps people with stubborn acne finally achieve clear skin and regain their confidence through diet and lifestyle changes. You can find her at emilianutrition.co.uk, and on Instagram, she is at Emilia Nutrition. Welcome.
Hello.
I'm so glad to have you here.
Yeah, I'm really excited to be on here and just talk about all things skin and hormones.
Yes, yes, so good. So before we dive into that connection that I think a lot of people, may not know about the skin and the hormones in the gut, let's talk about how you found yourself doing this work in the first place.
Yeah, so I first developed acne when I went through puberty. So it was probably around the age of 12, 13,
Mm.
which I guess is seen as pretty normal,
Yeah.
but it never really went away. It wasn't horrendously bad in my teens. It wasn't until I got to about age 20,
Mm.
and then it really flared up. And it was that typical kind of adult acne where it's kind of like a beard of spots that you develop all
Mm.
over the jawline. I couldn't fix it at all with topical treatments. I did start eating healthy. I started to change parts of my diet, but it was just getting worse. And then
Mm.
I looked into polycystic ovarian syndrome and thought, why didn't I know about this before? I have
Mm.
so many symptoms.
Mm-hmm.
Went to the doctors, did kind of had to fight for a ultrasound and some blood tests because I wasn't, although I had like changes in hair growth and acne, I didn't really struggle with weight gain or weight issues. And I hadn't tried at this point to have a baby. So I didn't have any
Mm-hmm.
issues. Well, I didn't know if I had any issues with
Fertility issues.
fertility.
Yeah. Yeah.
Yeah. But yeah, I got an ultrasound, had some blood tests done. I had high testosterone. I had cysts on my ovaries, and then they kind of went off the other symptoms and diagnosed me with PCOS. And then I went and
Mm-hmm.
saw a functional medicine practitioner, and we worked on all the underlying imbalances, and my skin cleared up pretty quickly and it just
Mm.
stayed clear. And then from there, that's how I ended up, yeah, studying nutrition and functional medicine and doing the same for other people.
Nice. So when you said you had symptoms of PCOS before you went in, besides the acne and hair changes, what other symptoms did you have?
Yeah, so again, it was things that I didn't really know weren't normal. So my cycle could be anywhere from like 32 days to 40 days,
Mm-hmm.
which is getting quite long, but they were regular, as in a sense of I never thought I missed a period, even though
Mm.
it
It
might be
was
that
just
it was going more
long.
towards 40 days. Yeah.
Mm-hmm. Mm-hmm.
So I didn't know that wasn't normal.
Mm-hmm.
And my periods were generally quite light, which I thought was a good thing. So they'd be
Yeah.
like 2 days max.
Wow.
And they wouldn't be heavy at all. Again, I just thought that was a good thing.
Sure.
But
You're like
yeah.
compared to all your friends are having these like horribly heavy periods, right? And we're just like complaining about it. You're like, well, it's no big deal.
Yeah.
Yeah.
Yeah, so it was those that there were symptoms I didn't know that were, yeah, possibly showing that I had maybe like low levels of estrogen, high levels of
Mm-hmm.
testosterone, some
Mm-hmm.
insulin issues, but also there was things that you don't think about as well. Like I'd get so hangry. I almost felt like I was having, well, I guess if I went periods without food, I'd get so shaky,
Mm-hmm.
hangry, just needed to eat like ASAP. I had loads of cravings. I didn't struggle from a weight gain perspective, but I don't know whether that would have been something that, maybe happened further down the line, because
Later.
when we did blood tests, I did have high insulin, high
Right.
HbA1c. Yeah.
Yeah, I just want to cut in there really quick because I think that's an important point that people automatically will look at larger people and think that they have some health issues, and they will automatically look at thinner people and think that they don't have health issues. And that
Mhm.
is not the case, right? We can't see what's going on inside of the body based on what's happening on outside of the body. And it can be it's frustrating on both sides, right? When people are trying to get help and support from their doctors, because if you're larger, they'll say just lose weight, and if you're smaller, they'll be like, nothing's wrong with you. And you're like, yes, there is actually, so um I think this is where when we get into specific testing around things like this, like you can certainly have high blood sugar, you can certainly have, I think a lot of people don't realize like hypothyroidism, because weight gain is supposed to be, a part of that. That's not necessarily the case. There's plenty of women with low functioning thyroids or even subclinical, hypothyroidism running around out there that are thin, so don't judge a book by its cover, essentially. And I think that's so important for people to take in, to their doctors too, is really advocate for themselves to get these tests done, because that's going to show you a whole lot more than just this, like they're looking at you and diagnosing you based off of that.
Yeah, definitely. I'd agree. And I think with a lot of the people that I work with, a lot of women do have a diagnosis of PCOS. And I'm definitely seeing a lot of like lean pictures
Mm-hmm.
of PCOS. It's not that everyone's struggling with like weight gain or struggling
Right.
to lose weight. Yeah.
Right.
So,
Yeah.
and it's interesting because it is usually when you do those blood tests that insulin is high. But I guess we'll talk about that
Yeah.
more.
Yeah. Well, let's dive into that, because I think I love talking about blood sugar on here. I love talking about it in general because it really does underlie so many issues, right? And particularly with hormones. Like, you just, no matter what your hormonal issue is, if your blood sugar is whack, it's going to be part of that spectrum, right? So, yeah, let's talk about what with PCOS you tend to see and how the blood sugar impacts that.
Yeah, so I tend to do blood tests that will just look at a lot of different things, because even if you just look at blood sugar, you're not
Yeah.
getting a full picture.
Yeah.
But insulin tends to be high,
Mm-hmm.
and then fasting glucose will be high as well.
Mm-hmm.
HbA1c will be another thing that's raised.
Mm-hmm.
And this is impacting your hormones, because when these are high, they can contribute to inflammation, and they can drive that testosterone up as well and contribute to testosterone becoming that more potent form of DHT, which
Mm-hmm.
isn't great from a PCOS perspective, and also an acne side as well.
Mm-hmm.
Yeah, and I see even if someone hasn't got a diagnosis of PCOS, from an acne side, it's really common to have those insulin levels high, and it's going to contribute to like blocked pores, increase in sebum production. I suppose you kind of just think of what happens through puberty,
Mm-hmm.
especially like a teenage boy. That's the kind of picture you tend to see when these insulin levels rise, and it then affects things like testosterone. You get oily skin, you get changes in hair growth. Yeah, and it's a big driver in
Voices
PCOS.
can drop, things
Yeah,
like that.
yeah.
Yeah. Yeah. Yeah. I find it, an interesting thing that, at least here in the US, insulin is not a regular marker that a doctor will check, right? They will check your blood sugar, your fasting blood sugar, and then if you're lucky, your HbA1c, right?
Mhm.
I have to often nudge clients if they're getting that done through their doctors to ask for that. And some doctors are up for it and some aren't. Insulin is rarely even a thought that crosses their mind. So that's something you have to ask for. When I do comprehensive labs on my clients, same thing, insulin is on there because your blood sugar can look just fine. Your HbA1c can actually look just fine or bordering, and then you see that insulin number and you're like, okay, this is where we're really seeing it. I don't want to say early necessarily, but we're seeing what this path is going to go down for your blood sugar
Mhm.
eventually. So, really, just your glucose, your fasting glucose isn't giving you that much information because I feel like it can look good kind of for the longest. Out of all, I have a client still, she tests, around 85, which is really, here, that's like prime optimal area, but then her HbA1c shows the truth of what's happening at like 5.7, 5.8, so yeah, that's something that, at least here, I don't know if the same is true in the UK, that you have to definitely ask for that insulin to be tested.
Yeah, I don't think I've ever had it. I've asked for it.
Yeah,
I've never had it back from a doctor. So it is something that we have to do separately,
separately.
especially if there's not like a family history of diabetes
Mm-hmm.
or any really prevalent diabetes or cardiovascular
Mm-hmm.
symptoms. Sometimes it can be hard to even get the glucose done through the doctors. So yeah, sometimes
Wow.
it's a lot of the stuff that we need to get done privately.
Yeah. Yeah. So would you recommend, if someone's had acne for a long time, or say, I think a lot of women that I know that, they had maybe acne when they were younger and then it went away and now it's coming back as they're in their 30s and 40s. Would you say start off with taking these tests?
Yeah, it tends to be blood tests tend to be the thing that I do most now, just because you
Mm-hmm.
can see so much out of one test.
Mm-hmm.
And from a hormone perspective, it's really good to see what's happening with your hormones, but without seeing things like blood sugar balance and inflammation markers and maybe getting an idea what's happening with your stress levels, you don't really know why your testosterone's high or your
Yeah.
estrogen's low. So I do think it's a really good place to start. And yeah, it's such a big driver for hormone imbalances to have issues with blood sugar levels. And often you can be eating really healthy, but your insulin can still be off balance, and that can be coming from things like stress,
Mm-hmm.
whether you've got a genetic disposition that puts you more at risk of like metabolic imbalances,
Mm-hmm.
all of those things. So yeah, I see a lot of people who are eating healthy, we
Mm-hmm.
test their blood sugars and they're still not good. So I do think it's a
Mm.
good place to start.
Absolutely. So well, let's talk first about some of the dietary changes that, may need to come into play, but also based off of what you're just saying, I'm curious what you recommend when they are eating really well and you're trying to like figure out, okay, so this is something else going on that's kicking up your insulin. So what do we do about that? But let's start with dietary approach first.
Yeah, so I think it's you've got a lot of options that you can do from a blood glucose insulin perspective.
Mm-hmm.
So if you have no idea where to start, I'd say a good place is increasing your vegetables and your fats and your protein, because they're
Mm-hmm.
going to help keep blood sugar stable when you eat and kind of reduce those spikes that can be happening, which then kind of exacerbate the whole process.
Mm-hmm.
So yeah, your healthy fats, um things like oily fish, avocado oil, olive oil, um, all those sorts of things are going to be really good, and make sure that you're adding them to food. Never have like carbohydrates on their own. And so that's a big thing. So if you're having something like toast for breakfast, the easiest thing to do is just add an egg on top
Mm-hmm.
or add some avocado on there. Even if you're just going to put peanut butter on there, I personally don't like that. I find it too dry, but
Yeah.
it's
It's
gonna
gonna,
help
yeah,
from a
slow it
blood sugar
down.
perspective.
Yeah.
Yeah. So
Yeah.
it's focusing on adding things to your diet rather than thinking I need to cut out all the sugars first.
Mm-hmm.
And I think when you've got to a place of I'm not just having these plain carbohydrates on their own, then you can look at kind of reducing things. So if you wanted to reduce your portion of carbs after that, or just swap it. If you're having things like white rice, you can swap over to brown rice. That's quite an easy swap to do.
Mm-hmm.
Um, use things like quinoa because it will have a higher protein content than other like refined carbs that you can eat. So yeah, I think those are simple things that you can do. And then after that, once you've kind of got on top of cravings, because you'll find when you've added things like proteins and fats and maybe swap to complex carbs, so the things like brown rice,
Mm-hmm.
you don't crave as many foods because you're not having these blood sugar like drops and spikes.
Mm-hmm.
And then you can start taking out things like, I don't know, a Diet Coke or some chocolate, that sort of stuff.
Mm-hmm. Absolutely. And, the big plus along the lines of what you're doing here is that your energy is also going to increase,
Mm-hmm.
right? Because people don't realize how tied up their energy is in those blood sugar swings, So it's like if you're just like up and down throughout the day, suddenly you're going to be like, oh, I feel more just like consistent energy, which
Mm-hmm.
for me, that's always the most exciting when a client's like, oh yeah, I noticed that I actually have more energy, and it's like, yes, because things are working in your body in the way that they're supposed to, and it's getting the fuel that it needs, which, like you said, protein and fats, and really, starting to build your each meal around those and get enough of those, and then fill the rest of that with carbs of whatever form to start, and then kind of get sort of healthier and healthier over time. That's what fuels our body, really.
Yeah.
Yeah.
Yeah. Yeah. It's amazing for energy. And I do think it's a really good thing to do because then people might have more motivation and energy to make other changes because they start to feel so much better with something that's quite simple. But
Yeah.
the other thing is that it affects mental health. So
Yes.
you might find that if you're going on a bit of a blood sugar roller coaster and you're having maybe toast and coffee for breakfast and then you have a sugary snack at some point as well,
Mm-hmm.
those drops can make you feel really anxious or stressed.
Mm-hmm.
And that's kind of contributing to the whole issue as well. If you're thinking
Mm-hmm.
about hormones, like sex hormones, and yeah, things like cortisol, you want to make sure that that blood sugar is stable to get that in place.
Yep.
And there's a huge impact on like skin, mental health, stress. So
Yep.
again, it's really good from that aspect as well to get that blood sugar stable.
Absolutely. And I just want to add on to that because it's such a big thing right now, right? And it's being talked about more, I think, recently in terms of how it's impacting women's bodies. But intermittent fasting has become such a huge thing, right? And so I don't want to say so many women, but there's definitely a decent amount of women out there that are waiting until like 12 or 1 to have their first meal of the day, and they get up and they drink coffee, and that's like okay on intermittent fasting, and it's like shooting your cortisol up, first thing in the morning. You're not giving your body any fuel. And I actually was just reading this one, I think she's a carnivore, and she was talking about how she basically couldn't lose weight even though she was eating strict carnivore and doing intermittent fasting. And then she realized for her, just like literally eating first thing in the morning changed that all around, So no matter what dietary approach you take, it's so important for our blood sugar stability and that cortisol stability, excuse me, to get, the first meal of the day in within like the first hour of you waking up, in my opinion.
Yeah, it's something I see a lot in clinic as well. And even if someone isn't hungry, I just try and get them to eat a little bit of
Yes.
protein. And I think a lot of people are actually surprised that it kickstarts their digestion just by
Yes.
eating something in the morning. And if you
Mm-hmm.
are going to have those bigger set meals, so breakfast, lunch, and dinner, you just stick to 3 and you don't snack, you
Mm-hmm.
are still getting, you can still get like a 5-hour fast between meals rather than
Mm-hmm.
doing, yeah, that huge overnight fast. And
Right.
it's worse, I guess, if you wake up pretty stressed and
Right.
then your job's stressful and you're sat in traffic and you're even more stressed, and then to
Mm-hmm.
add to the stress, you haven't ate since 6 p.m. last night.
Right. 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 And really, for a cycling woman's body, I find that like 12 hours is plenty to give your body a break from food, right? So if you eat 6 or 7 p.m. and then you don't eat again until 7 a.m., that's a nice break, So so much of the research has been done with intermittent fasting has been done on men's bodies. And it's just different when you have hormones that basically stay the same throughout the month, versus these up and downs and what our body needs to feel safe in order
Mm-hmm.
to cycle properly,
Yeah.
right? So, okay, so let's go back to I wanted to actually ask you to talk about, you mentioned about DHT, which I've talked about on here before, but I'm not sure that everybody knows that and understands sort of how our hormones metabolize and how they can go down these different pathways. So could you share that?
Yeah, so I suppose if you're doing You can test it in blood. You can see your DHT levels in blood. But a lot of people might be more familiar with it on a Dutch test, where you can see that, like, kind of when you look at your androgens, you can see those two different forms of, you've got testosterone on one side and then you've got this DHT form on the other side. And you can actually have low levels of testosterone but high levels of DHT, which can be confusing if you test on, you do a blood test and you're not looking at DHT and you have low testosterone, and then you think, but I've got all these symptoms of testosterone. It could be that it's going down that pathway, which is more potent. So you can still get those symptoms of increased facial hair or body hair. You might have hair thinning and things like acne, oily skin, like you said, the deeper voice as well. So it's a 5-alpha reductase enzyme that's converting these androgens down this pathway, which is so much more potent.
And do you have a recommendation on what can help not push down that pathway, or push down that 5B pathway instead?
Yeah, so zinc's a really important one. You might want to go a bit higher on a zinc dosage for a short period of time to really like focus on that enzyme and block it and make sure it's going down to testosterone, and just help to regulate testosterone levels. Things like green tea and matcha I'm a massive fan of, because I think they're quite easy to add in to your diet. And then things like saw palmetto is a herb that can be used as well commonly, and lycopene. So just getting people to increase like tomatoes, tomato puree, these can all help to kind of help with healthy testosterone levels and block that pathway. But interestingly, you can do it topically on the skin as well. I mean, you always want to focus internally, but yeah, there are certain topical things that you can do to help with reducing that conversion within the skin.
Oh, I didn't know that.
Yeah, so things like, again, zinc, B5, and linoleic acid is another good one. So it might be why evening primrose can be beneficial topically.
Interesting. Yeah. Well, and you think about zinc is well known for being helpful for the skin, right? I mean, healing for the skin, all of those. Interesting. I never knew that it could actually do the conversion there on the skin. Fascinating.
Yeah.
Okay, so I definitely want to end up getting, into talking about more herbs and things like that. But let's go back to what you mentioned earlier. Sometimes women are really eating a clean diet, or a diet that suits their bodies well, and they still are having, the high T issues, the high blood sugar issues. So what do you do in that case? And what are some of the ways that, that they need to support themselves?
Yeah, so I think if that's happening, so if someone's come in and their diet is like perfect, and then we get that result, is when you need to look at the full picture. So the gut microbiome can contribute to imbalances in insulin and blood sugar regulation. Stress is a big driver of it as well. Inflammation. So again, with inflammation, you want to be thinking what's causing inflammation. And again, that could be coming from the gut microbiome. It could be a genetic disposition that you might be more prone to. Again, it can be stress. It could be underlying infections. It could be a lack of beneficial bacteria, damage to the gut lining. So all these things could be contributing to it. And that's when you need to zoom out and look at all those things and kind of tick off what's not causing it and then focus on what possibly is.
So do you utilize gut testing in that process?
Yeah, so I will often combine like a blood test with a stool test, because I think the more you do stool testing, the more you can kind of maybe take an educated guess of what's happening from a gut perspective. But there's a lot of times where you think you know what's going to come up, and then you do a stool test and you're like, whoa, wasn't expecting to see that.
100%. That happens to me all the time.
Yeah.
I'll be like, yeah, I'm pretty sure that there's H. pylori going on, and then it doesn't show up on the test, or vice versa, with some of the opportunistic bacteria. So I get that, you're like, well, that's why testing's helpful, right? Because otherwise we're just guessing.
Yeah, definitely. And you get so much information from doing like a comprehensive stool test as well. You're looking at inflammation within the gut, which is going to affect hormones and your skin. So it can manifest in the skin as well if you've got issues going on from a gut side. Yeah, and just looking at those levels of bacteria. So a lot of the time, it's not that someone's got an infection necessarily. It could be that they've got high levels of beneficial bacteria, but when they get to those levels of the levels that they're in, they start to cause an issue.
Right.
So you can rule out all of that. And then the thing I really like as well is when you get to see an insight to people's digestive function. So looking at those products of protein breakdown, you can see that, and that's really important for seeing if someone's actually getting, because you can be eating really well, but if you're not digesting and absorbing, you're not getting the benefits. So that's another thing that can happen if someone's eating really healthy and they're not seeing benefits.
Yeah,
It could be that you're not actually absorbing it.
Yep, not breaking it down, absorbing it. That's, I think half the issue for a lot of people out there that are eating healthy already, and they're like, I don't understand. It's like, well, it's what you digest and absorb, not just what you eat. And what did you just say that I wanted to about the beneficial bacteria? I thought that was a really good point too, because people think, oh, I just want as much of the good bacteria as possible, and that's not true either, right? Because good guys can become bad guys essentially if there's too many of them, right? And so our microbiome is such a balance, and we really want to see what's happening in there so that we can bring things more into a balance instead of just like high levels and low levels of these different things, which is, I'm sure, what you see a lot on testing too. As I do. Yeah. Yeah. And also, I love that you've said this word several times. And I think it's important to always come back to is talking about inflammation, because inflammation really underlies every disease, and all the things that you're talking about is, hey, let's work essentially on the inflammatory responses that are going on and calm those down. And it's like everything in the body works better when the inflammation comes down. And these are the different ways that you can get inflamed, really.
Yeah. And it's such a, I suppose you can see it more maybe if someone's got like more progressive inflammatory acne, they've got really inflamed cysts, you can kind of, attach the inflammation. It's more easy to kind of see it, but maybe from a PCOS perspective, if someone's not suffering with really bad acne, because that can happen as well. Not every woman with PCOS has acne.
Right.
It might be a little bit harder to...
even ovarian cysts. They don't always have them too. So
yeah. So it can be hard maybe to kind of process that I've got inflammation when I don't have that visible pain or redness that you can see. But you can see that in a blood test as well. So the markers like ESR, CRP, high sensitive CRP, things you can get tested to see where you're at from an inflammatory perspective. But then also you can see it in the gut. So it might be that secretory IgA is really high, calprotectin is really high. They will give you insight as well to inflammation.
Absolutely. Such good stuff, because really, when you're working on, this one area in this instance, which we're talking about acne, you're really impacting all the systems in the body from a beneficial perspective, right? Because those inflammatory markers, can be pointing to inflammation in different parts of the body, like especially like we look at that high, the high sensitivity one. It's like, okay, so there's probably some heart inflammation going on here. So there's just like all of these benefits to taking this approach, even just beyond you're healing your acne, right? You're like really healing your body.
Yeah. And it's something that I think can be a positive with having acne. I know that it'll be really hard for someone to hear if they have active acne now, and they're thinking, how the heck is this a positive? But you can see that there's something happening topically on the skin, and it forces you to dive deeper. Whereas someone who's maybe more prone to something like cardiovascular disease, you don't have that warning sign. You might just one day have blocked arteries and have a heart attack, and you don't know.
Yeah, that's a really good point. And I think that's, it's definitely a mindset shift that we have to make. But when our bodies are, under duress and they're letting us know, that really gives us this opportunity to make the changes that need to be made versus, not knowing, and I mean, sometimes for myself, I'm like so tuned into my body. Sometimes I'm like, I wish I wasn't, because it's like every little thing. I'm sure you're similar, right? Like once you've gone through this, you're just like, okay, I'm sort of hyper vigilant. But I do know right off the bat if something isn't good for my body or isn't working for my body, and so what I tell my clients all the time is develop that relationship with your body, because it does want the best for you. It is letting you know that something's off, so that you really do have this opportunity to work with it now before it gets worse, you know?
Yeah.
And I know that's hard when nothing bad has ever happened to you. Like, I get it. You're just like, but I feel fine. It's like, well, yeah, but this is probably going to happen down the road. And I get it. So sometimes people need a wake up call, but if you can get there before having the wake up call, life is so much easier.
Yeah, definitely. Definitely.
Yeah. So let's talk about the stress component, and what recommend for your patients that you see that that's part of the issue.
Yeah, it's a hard one. I guess it's a hard one with all chronic
Mm-hmm.
disease, but I
Mm-hmm.
think when acne's because people are so, your appearance makes such a difference to your self-esteem and
Mm-hmm.
how you interact with other people. There is a huge issue with skin conditions and the mental health side. So
Mm-hmm.
having that skin condition in itself is very stressful.
Mm-hmm.
People with any skin condition really are more prone to things like anxiety, depression. It can affect their intimate relationships. They can have social withdrawal. They just don't want to be seen.
Mm-hmm.
So it's definitely a hard one.
Mm-hmm.
There's the things that we've spoken about that you can do from a nutritional standpoint. So working on the stress response, maybe with supporting adrenals and putting some of those calming herbs in, things like magnesium can be really, really nice just to support the stress response. But
Mm-hmm.
then also, I think this is where it's really good to combine like all the therapies. So, if you can speak to a therapist, I do often encourage that someone tries to speak to a therapist just to talk through how they're feeling. And also things like
Mm-hmm.
CBT can really help
Mm-hmm.
with your thought processes. So you might
Mm-hmm.
go, it was definitely something I was doing when I had really bad skin. I didn't want to go out because I thought everyone's just going to stare at my skin and they're going to be thinking, God, isn't her skin really bad?
Mm-hmm.
Looks really painful,
Mm-hmm.
whatever else they could possibly say.
Mm-hmm.
But it doesn't it like you don't know if people are actually thinking that,
Right.
and CBT can help with changing your mindset, which then helps to reduce stress, which will help with
Mm.
inflammation and hormones, because it's really hard to get these balanced yeah, when you're really, really stressed. But then also if you're working topically on the skin, you can help to reduce some of that inflammation, and that can help from a self-esteem perspective as well, because you'll see benefits quicker when you're
Mm-hmm.
combining all of them together. So yeah, I think the
Mm-hmm.
combination of working on your mental health. I mean, if you can't afford to see a therapist, there's other things that you can do, like
Sure.
just things that you enjoy, meditation, yoga, deep
Mm-hmm.
breaths. Even like positive affirmations can help with that thought process as well. So
Yeah.
those are things that you can do.
Yeah. And I always tell people, it's a huge component of any health issue, right? Is the trauma that we have stored in our bodies, the belief systems, all those kinds of things. And so I do think it's so helpful if you're able to work with a therapist that you really feel connected to and that can truly support you in the process, right? Because doing that alongside the dietary changes, the supplements, and all of that is going to give you so much more success, really. Because
Mm-hmm.
that people don't always understand that trauma that's kind of stuck in the body, can consistently run our stress system, kind of keep us in this more fight or flight response all the time. So it's really hard to get into our calming parasympathetic nervous system without actually kind of rooting out that trauma.
Yeah. And I suppose when you're talking about the hormone pathways as well, if you're
Mm-hmm.
stressed and you're trying to
Mm-hmm.
balance hormones, it's so
Good luck.
hard to do.
Yeah, good luck. I know. That's why people are always like, why are you talking about stress stuff all the time? Why are you talking about cortisol all the time? Because you have to tackle cortisol if you're going to work on your sex hormones. People, kind of like you said earlier, people want to jump to maybe hormone testing or seeing where their testosterone is at. And it's like, yes, that's useful information, but that's kind of what's happening up here because of everything that we need to get at that's down here, right? It's
Mhm.
like we need to get in here and change the course of things, and that's going to be what impacts your hormones rather than trying to go in necessarily right off the bat and test your hormones and be like, okay, and depends on the individual. I won't say that I don't ever go in early and test hormones, but you really getting the foundations in place that we've talked about today and using a lot of the blood tests that you talked about, that's really the places that we want to start and really support the body from those perspectives.
Yeah, definitely.
Yeah.
And stress is going to have a huge impact on how well you're absorbing those nutrients to create healthy hormones as well. So it's not even that it's just like you're creating cortisol instead of things like progesterone, and because they're not safe to have a baby.
Yep.
That's what your body's really thinking. So why would it make things to make you have a baby when you're not in an area that's safe to reproduce?
Yep.
But yeah, you won't, if you're stressed, it kind of shuts down the digestive system. So you're not going to be absorbing the things that you need to even make hormones. Well, it's not that you're not going to have any, you will have some.
Right.
Yeah, you're not going to have those raw materials as much as you need.
Absolutely. And I always tell people, whether or not you want to have a baby is kind of irrelevant, right? Is that the word? Irrelevant?
Yeah.
I was like,
so.
That sounded weird when it came out. But we want our bodies to feel like we're trying to get pregnant, like it's like I totally get you not wanting to get pregnant. I've been through that my entire life, but the point is to make your body feel that way, because that is how your menstrual cycle is going to work properly, to be, safe, secure, have all the materials that you need, have the communication between your brain and your ovaries working really well, that whole feedback loop. And yeah, that's not going to happen if your body thinks that you're running from a saber-toothed tiger, like if you think evolutionary wise, that is our bodies, we're going to shut down that process of being able to hold and grow a life if we're trying to protect our own life. And so when we're caught in this stress response all the time, it's like your body's like, oh, we're freaking out. We're just trying to keep you alive right now, So okay, so I know we're coming up on time, but let's really quickly talk about any other herbs or nutrient supports that you haven't mentioned that you feel like are really helpful when it comes to acne.
Yeah, I think a big one is definitely, I did talk about it a little bit, but your essential fats. So they're going to be really important for reducing inflammation within the skin. They help with just the skin cell cycle and making sure that you've got a healthy skin barrier and regulating oil production. And then it also helps from a hormone side as well. And it's not just omega-3, you definitely want a lot of, because it can be hard to get that perfect ratio. From a diet perspective. So definitely do like a higher dose omega-3, but also I think people can be scared of omega-6 because they don't want to throw off that ratio. Again, it's something you can test so you can see where you're at with your omega-6 and omega-3 ratio. But omega-6 is really important for skin barrier production, skin barrier health. And when you combine them, it can be really nice to just help reduce inflammation. So yeah, those good forms of omega-6 are really beneficial for reducing inflammation. So yeah, if you're not eating fish or you're vegan, you can get a vegan omega-3 that you can take. You just might have to take a few more capsules to get the equivalent of a fish oil. But yeah, that's really important. I'd say majority of my clients are being put on some sort of omega supplement to help with skin. And then
I guess you really quick before you go on. So when you're talking about the omega-6s, that most of us get dietarily, through the oils and things that are cooking our food in, but you're also maybe talking about other things like, there's a couple of different ones, right, that are particularly good for skin. And I'm trying to think of the ones
as in like evening primrose.
Like evening
borage,
primrose. And borage. Yeah. That's what I was like, where is it? Yeah. So those are kind of the specific ones that you're focusing on, rather than say like, obviously I know you're not trying to say canola oil or whatever, but these specific skin omega-6s that are really supportive of skin, essentially.
And also things like sea buckthorn oil, slightly different omega that it's higher in, but a really nice one for reducing inflammation. And you can take it topically not topically, orally. If you were going to use it topically, or if you've got any skincare, it's very orange, so it'll probably stain. But
interesting.
You can put that in. It's so orange. So I'd say do it from a dietary perspective.
Yeah.
And you can add it to foods, or it does come as a capsule as well, but that can really help with moisturizing the skin and reducing inflammation.
I know some people will recommend doing, say fish oil for the first half of your cycle and evening primrose or borage seed for the second half, that luteal phase. Do you recommend doing that, or does it matter? Can people take it at any time?
Yeah, I suppose I typically tend to probably stage it as I put in omega-3 first because I
Mm-hmm.
find it works really well for reducing inflammation. So a high dose of omega-3. And then when we're kind of getting through a protocol, maybe want to do a little bit more topical support, I then put in evening primrose. But yeah, I don't tend to cycle it, but I know that some people do, and it
Mm-hmm.
can help in that way. But generally, I'd say my go-to is more so omega-3, and
Yeah.
then I'd use them together throughout the cycle.
Gotcha. And I think it can get complicated for people sometimes to say, this part of your cycle do this and this part of your cycle, and they're like, wait, what?
Yeah, you
So,
forget, and then you end up not taking it, and you
right,
don't get the
right.
benefit.
Yeah, it's like just go ahead and take it the whole time. You'll be fine. So, okay, that cut you off earlier when you were talking about other herbs or nutrients.
Yeah, so I guess again, it depends what happens from a testing perspective. So
Mm-hmm.
we spoke about what's good for testosterone. There are other botanicals that you can use for like balancing estrogen and progesterone.
Mm-hmm.
So I'd say with progesterone, you might want to focus on stress because that can be a big killer of something like
Yeah.
progesterone. So yeah, some of the calming things like chamomile, also a really good one for reducing inflammation and supporting gut health. Magnesium, I guess it's not a herb, but it's
Right. No,
something I use
nutrients
a
are
lot.
fine too. Yeah. 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 Absolutely. It doesn't have to be all herbs. Well, and do you
Yeah,
find most women with PCOS do end up having that low estrogen?
it can go either way.
Mm-hmm.
Sometimes I see people with low estrogen, low progesterone because they're
Mm-hmm.
not ovulating, so they
Mm-hmm.
won't have healthy progesterone levels. But also because testosterone can then aromatize and
Aromatize. Yeah.
convert into estrogen, you
Mm-hmm.
can actually have high testosterone and high levels of estrogen at the same time.
Mm-hmm.
So yeah, some things that are really good if you've got high levels of estrogen, which is also going to be inflammatory and might contribute to things like fibroids and cysts at
Mm-hmm.
the same time. Things like broccoli, all your cruciferous vegetables, but yeah, I tend to go more so for broccoli sprouts, cauliflower. Those are
Mm-hmm.
really good for helping to promote more healthy versions of estrogen.
Mm-hmm.
And to help reduce inflammation as well.
Mm-hmm.
Yeah, and then I guess there's other herbs like Vitex that people might try.
Mm-hmm.
But again, I think you can't just go in with some of these herbs that say that they're going to help with progesterone and estrogen and then not be thinking about why they were off balance in the first place. You could
Right.
take loads of Vitex and nothing happens because
Absolutely.
it's further upstream that it's actually causing the issue.
Right, absolutely. Because I think a lot of people will jump to an herb that they hear is really good, or even a nutrient that they hear is really good for these things. And it's like, but you need to find out specifically what's happening in your body. I mean, for example, going back to the zinc, that is something that you can test for, and you can even see in your alkaline phosphatase on a regular
Mm,
panel, right? That's low. And that is a big one for a lot of people. And so that's why I'm such a big proponent of doing these, especially some of these basic blood tests where we can really figure out a lot and just support those nutrients being uplifted in your body and getting your digestion working well too, right?
yeah,
And then you can like bring in some of these other herbs to support, once you've got those foundations in place. So
yeah.
yeah. Yeah. Well, thank you so much for this amazing, tutelage on skin health and PCOS. I think that, unfortunately, PCOS is definitely underdiagnosed, at least here in the States.
Mm-hmm.
And that, they're really, it's not, I don't want to say it's not easy, but there's a simple path towards actually working with it from the root cause, which we've talked about today, right? So I'm definitely not saying it's easy because there's, making changes and bringing in changes takes time, and you should work with a practitioner on that and get really specific, like we've talked about today, and figuring out what's going on in your body. So tell everyone where they can find you.
Yeah, so I think I'm most active on Instagram.
Mhm.
So you can find me on Instagram. I guess
Okay.
if you want to ask any questions, that's where it's best to do it. So yeah, my Instagram is Emilia Nutrition. And then I do have my website as well. If you wanted to send me an email, all my contact info is on there,
Sounds good.
which is
And
emilianutrition.co.uk.
are you able to work with people outside of the UK or just in the UK?
Yeah, I do work with people outside of the UK. I'd say because I'm based in the UK, most of my clients are
Sure.
UK based,
Yeah.
but I do, yeah, we can work around like time zones and
Yeah.
stuff. So I do have people elsewhere and we work online one
Yeah.
to one.
Sounds good. Yeah. We definitely, there's definitely listeners in Europe and the UK on this for this podcast, which I'm so glad you guys are all here. But also, I just was wondering for anybody in the US that's looking for somebody. So, yeah, I'm the same thing. One of my coworkers I mentioned to you earlier, she's in Belgium and we're like navigating the time changes all the time, but you make it work. I mean, it's not really that bad during the day, during the week. You can make it happen.
Yeah, you
So,
might just someone ends up being a little bit early or a little bit
yeah,
late in the day.
exactly. That's it. All right. Well, thank you so much for being here with us today.
Yeah, thanks so much for having me. It was really fun talking about
Abs-
everything.
I know it's good stuff. All right, you guys, I will see you next time.